Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's July 16th, and we have a lot to talk about. Last week, I was in London attending a meeting of the International Progressive MS Alliance Scientific Steering Committee. And although I spent the week in the UK, today we're going to be talking about a uniquely American challenge for many people living with MS here in the States. My guest is Jamie Hall, an attorney who specializes in Social Security disability matters and private long and short-term disability claims. And as many of you already know, applying for Social Security disability benefits, well, it can be difficult. It's a stressful and challenging process with an outcome that seems fraught with uncertainty. Well, Jamie Hall has represented Social Security disability claimants before administrative law judges and the Appeals Council in 24 different states. He's also a strong supporter of the National MS Society, where he's conducted numerous seminars on Social Security disability issues. Jamie is a member of the MS Society's 2010 leadership class, and he and his firm have served as a corporate sponsor for a number of different programs, including Walk MS and Bike MS. Jamie's also served as an editor of the National MS Society's SSDI guidebook. But before we get to Jamie Hall and what you need to know as you approach the Social Security disability gauntlet, or if you're already stranded in the middle of that gauntlet, well, there are a few other things that you should know about. If you're living with MS or any other chronic illness in the United States, your ability to access quality health care may have taken a step closer to disappearing last week. Because last week, 2 Republican governors and a group of Republican state attorneys general, along with the Trump administration's Department of Justice, asked a 3-judge appeals court panel to uphold a lower court ruling and declare the Affordable Care Act unconstitutional. And because of the partisan makeup of that appeals court panel, legal experts are saying that this time it could really happen. So let me say right up front that it isn't my intention to make this a partisan political conversation, but we're not going to ignore the obvious either. And all of the parties involved in almost any part of the discussion about the Affordable Care Act, well, they've already made it a partisan political discussion. The facts are that 100% of the parties involved in requesting the ACA be declared unconstitutional are Republicans, and 100% of the parties involved in defending the ACA are Democrats. And when we talk about being an MS activist on the podcast and we talk about the power of advocating on your own behalf, we need to be crystal clear about who is supporting us and who isn't. Who's working for the things that will make life better for families affected by MS, and who's working to make life more difficult than it already is. But that isn't even as easy as it ought to be. Because while Republican politicians are in court attempting to invalidate the Affordable Care Act, you have the Republican Senate leader, Mitch McConnell, saying, and I'm quoting now, "I think the important thing for the public to know is there is nobody in the Senate not in favor of covering pre-existing conditions." And then you have our president saying, again, I'm quoting, "We will always protect patients with pre-existing conditions." Well, these are great things to say, but only if you mean them. And in both of these cases, these are bold-faced lies. Here's what you need to know about how we got here and exactly who's responsible. Before the Affordable Care Act, insurance companies could deny coverage to anyone with a pre-existing medical condition like multiple sclerosis, or they could choose to provide coverage, but it was only made available at outrageously high premiums. Well, the Affordable Care Act, the ACA, made that practice illegal. It mandated that people with pre-existing medical conditions must be protected and offered affordable health insurance. And although the ACA became law, please remember, every single Republican in the House and the Senate voted against it. And once the Affordable Care Act became law, congressional Republicans in the House of Representatives voted more than 50 times to repeal it. And for the sake of clarity, they never offered anything in the way of a new proposal that demonstrated their stated desire to protect people with pre-existing conditions. Never, as in not even one time. In 2017, the Republican Party won the presidency and they won both houses of Congress. They put together a bill to repeal the Affordable Care Act, and that bill failed by the single vote against it, a vote famously cast by the late Senator John McCain. Just a minor side note to history here, that upcoming vote on that bill motivated me to launch RealTalk MS a few weeks ahead of its planned launch date, because I believed that the bill to repeal the ACA and eliminate protections for people living with pre-existing conditions represented an existential threat to the 1 million families living with MS in the United States. And I wanted to add my voice to help mobilize opposition to the bill throughout the MS community. Well, now let's fast forward again to 2018. 20 Republican state attorneys general file a lawsuit claiming the ACA was unconstitutional. And it should be noted that even conservative legal scholars labeled that lawsuit as ridiculous and totally without merit. But they were smart. They filed the lawsuit in Texas so that it would be heard by U.S. District Judge Reed O'Connor, an outspoken and extraordinarily partisan Republican judge. And Judge O'Connor ruled that the ACA should be completely wiped out, eliminating its protections for people living with pre-existing conditions. Well, of course, his decision was appealed. That's when the Trump administration chose to sign onto the lawsuit, asking the appeals court to strike down the ACA and its protections for people living with pre-existing conditions. So to quickly summarize, there's been a 10-year effort, 100% on behalf of the Republican Party, to repeal the Affordable Care Act and eliminate its protections for people living with pre-existing medical conditions. And during this entire decade, the Republican Party has never once offered an alternative plan that would keep those protections in place. There's been a lawsuit filed by Republican attorneys general and supported by the Trump administration to declare the ACA unconstitutional. The Republican-appointed district court judge in Texas ruled in favor of that lawsuit, and last week, 2 Republican-appointed appeals court judges seemed as though they were ready to rubber stamp that ruling. So those are the facts. It's not a partisan debate. It's history. And if it sounds as though the Republican Party has from day one positioned itself on one particular side of this issue, well, there's not much any of us can do about that, except remember it when it's time to vote. Now, regardless of what ultimately happens at the appeals court level, this case is surely headed for the U.S. Supreme Court for a final ruling, so things aren't about to change overnight. But please don't, for even a second, fail to recognize the very real danger this court action represents to everyone living with MS and any other chronic illness in the United States. And equally important, understand exactly who's responsible. And just to be clear, the ACA is far from perfect legislation. But when we're faced with an imperfect law, then our lawmakers can choose to fix the problems and make it better, or they can choose to blow it up. And when it comes to this law, when it comes to the ACA, the Republican Party has from day one made it clear that they're out to blow it up, and aside from a couple of patronizing speeches, not give a damn about how much human wreckage they leave behind in their partisan political frenzy. And I just think that if we fail to change their minds through our advocacy efforts, then we should, at the very least, reserve the right to hold them accountable when it comes time to cast our vote in the 2020 election. This past December, the Multiple Sclerosis International Federation applied to the World Health Organization, or WHO, to add 3 MS disease-modifying therapies to its 2019 Essential Medicines list. And last week, the World Health Organization announced that none of these 3 treatments would be added at this time. The WHO Expert Committee acknowledged the public health need for effective and affordable treatments for MS and requested that the MSIF submit a revised application in 2 years. When the MSIF surveyed all of the available MS disease-modifying therapies, they selected one drug that offered moderate efficacy at high safety, one drug that offered moderate to high efficacy in oral form, and one high-efficacy monoclonal drug. So the MSIF requested that Copaxone, Gilenya, and Ocrevus be added to the essential medicines list. The WHO Executive Committee commented that when it came time to considering the outcomes of these therapies in terms of benefits, harms, and affordability, the superiority of these specific medicines over other therapeutic options did not clearly emerge, and that off-label therapeutic options for treating MS were not fully considered in the application. But it should be pointed out that the MSIF chose the 3 disease-modifying therapies put forward in their application based upon safety considerations, tolerability, monitoring needs, route of administration, licensed use in pediatric MS and primary progressive MS, and safety profile in pregnancy. The affordability of the 3 therapeutic candidates was considered in relation to the availability of generic, biosimilar, and off-label alternatives. The MSIF's application to add these drugs to the essential medicines list was made in collaboration with the World Federation of Neurology and treatment and research in MS committees in North America, Latin America, South America, Europe, Asia, Russia, and the Middle East. Letters of support for the application were submitted by more than 20 MS patient organizations around the world. Having fallen short of their goal, the MS International Federation is continuing their discussions with the World Health Organization, reconsidering the best approach, and figuring out their next steps to ensuring access to treatments for people affected by MS everywhere in the world. Back in 1983, the Police released a song in which Sting warned that with every breath you take, I'll be watching you. Well, if a research team in the UK is successful in their efforts, in the not-too-distant future, your neurologist might be able to say that with every breath you take, I'll be diagnosing you. Every time we exhale, we release hundreds of what are called volatile organic compounds, or VOCs, into the air. Analyzing these VOCs can give doctors a snapshot of the metabolic condition of an individual, and they can also provide early clues about changes happening in that individual's body, changes which might not be otherwise apparent. So in a small study, scientists from the University of Huddersfield's Center for Biomarker Research found that people living with MS exhale some volatile organic compounds which may be unique, giving them a unique breath signature that can actually be measured and identified. They also found that some of these VOCs might reflect changes in a person's gut bacteria. And over the past few years, there's been a lot of science that shows that there's some sort of connection between our gut bacteria and our neurological health. So a large study is underway to collect breath samples from people living with MS at various stages of the disease to see how these volatile organic compounds may differ, and then to compare them with people who don't have MS. So just imagine if being able to diagnose MS could be as simple as taking a breath test. Think of how much more user-friendly and cost-effective a breath test is when you compare it to a lumbar puncture or an MRI scan. And this large study may even show that MS progression can be determined by this breath biopsy. And while this all may sound more like science fiction than science, the preliminary study data indicates that diagnosing MS by means of a breath biopsy is a serious enough path that it warrants further exploration. And if you'd like to review the preliminary study results, well, you'll find a link in today's show notes. We've talked a lot on the podcast about depression and MS. I think it's an important topic because depression just gets in the way of pretty much everything in life. The reality is that you won't be living your best life if you're living with depression. And unfortunately, we know that about half of all the people living with MS are going to be diagnosed with clinical depression. And this kind of a conversation goes way beyond the fact that your mood can color how you perceive and interact with the rest of your world. Research has shown us that depression can actually make many of your MS symptoms worse. So while we don't yet have a cure for MS, depression can be successfully treated. And by treating your depression and therefore improving some of those MS symptoms, well, you actually get to enjoy a higher quality of life. But what does treating depression really mean? Well, for some people, it might mean getting a prescription for antidepressant medication like Prozac or Lexapro. But the results of a large study in Australia suggest that before you even have to consider adding another prescription medication to your daily routine, you should first look at the lifestyle changes that you can make. Researchers at the University of Melbourne and the Menzies Institute for Medical Research surveyed 1,500 people who were living with MS to better understand the role of lifestyle factors like smoking, nutrition, alcohol consumption, and levels of physical activity when it came to multiple sclerosis. The research team also used the survey to gather data on anxiety and depression. Then the scientists analyzed the survey results to see if there was any identifiable connection between these lifestyle choices and the occurrence and severity of symptoms of anxiety and depression. The researchers found that most people with MS, about 90% of the survey respondents, didn't smoke. And the great majority, about 83%, consumed alcohol within recommended levels. Only 10% of the survey respondents consumed the recommended daily servings of fresh fruits and vegetables. Just over half engaged in adequate levels of physical activity, and less than half, about 38%, had what would be considered a healthy body mass index. Overall, just 3% of the 1,500 survey respondents, now that's less than 50 people, met all 5 healthy lifestyle requirements. And these are lifestyle choices that we can control. Choices that will have a positive effect on your quality of life, your overall well-being, and your ability to live your best life with MS, which tells you just how big the opportunity is for most people living with MS to improve their own lives without any pharmaceutical help, without additional visits to medical specialists, and without added expense. I'll let that sink in for a minute while I tell you that the analysis of the survey results also showed that smoking 1 or more cigarettes a day and consuming more than 2 alcoholic drinks a day were linked to an increased level of depression. And the severity of depression was shown to increase as the level of smoking increased. And the survey respondents who followed a healthy diet, consuming 5 or more servings of vegetables a day and 2 or more servings of fresh fruit every day, well, they were found to have lower levels of depression. Now, this survey shows the link between what are considered modifiable lifestyle factors and depression among people living with MS. Understanding whether making better lifestyle choices can effectively manage depression in MS is going to require additional research. But as I say about eating chicken soup when you have the flu, it couldn't hurt. Now, if you'd like to review the details of this study, I'll include a link in today's show notes. And if you've listened to Real Talk MS for a while, well, you might be wondering why I think this subject of depression is so important. You might be asking yourself why I seem to be, almost constantly talking about research relating to managing depression among people living with MS. Well, to be honest, there are two reasons that are both very important to me. The first reason is that I saw firsthand how depression impacted my wife Jean's battle with MS. And having lived through that, I wouldn't want it to happen to anyone if there was even a chance of preventing it. The other reason is one that isn't talked about very often, but it should be. And it's something that was recently confirmed by a research team that completed an analysis of 16 separate studies that measured suicide risks among MS patients. And this analysis shows that being diagnosed with MS statistically doubles your chances of dying by suicide. If you think back to 1990, you might recall the name Dr. Jack Kevorkian. He was sometimes referred to as Dr. Death because Dr. Kevorkian was a strong advocate for a patient's right to die by physician-assisted suicide. He even went to prison over it. Now, what many people may not know is that half of all of Dr. Kevorkian's assisted suicide victims were people living with progressive MS. So when I think about the effects of depression on someone who's already living with the heavy psychological burden of having to deal with a progressive and incurable disease, well, I consider treating that depression to be a matter of life and death. It's about as serious a subject as there is. And my most heartfelt wish is that if you're living with MS and struggling with depression, first, know that you're not alone. There are people who are ready to help you. And know that you can improve your day-to-day quality of life by talking to someone and getting that help. If you'd like to review the details of that meta-analysis of studies that measured suicide risk in MS patients, I'll include a link in today's show notes. On a much different note, we know that living with MS can be tricky, and the word tricky can be a euphemism for sometimes unbearably difficult. The truth is that it can be hard to navigate life, family, or a career while you're living with an unpredictable chronic illness like multiple sclerosis. What makes life with MS even more unpredictable is trying to navigate the Social Security bureaucracy when you apply for Social Security disability benefits. And that's where my guest comes in. Jamie Hall is an attorney who specializes in Social Security disability matters and private long and short-term disability claims. And as a member of the National MS Society's 2010 leadership class, Jamie is particularly aware of the challenges faced by people living with MS as they apply for disability benefits. In a moment, we'll meet my guest, disability benefit expert, Jamie Hall. As many people living with MS already know, applying for Social Security disability benefits can be challenging. It's a stressful process with an outcome that seems fraught with uncertainty. Well, my guest today is Jamie Hall, an attorney who specializes in Social Security disability and long-term disability claims. Jamie has represented Social Security disability claimants before administrative law judges and the Appeals Council in 24 different states. He's also a strong supporter of the National MS Society, where he's conducted numerous seminars on Social Security disability issues. In fact, Jamie's a member of the MS Society's 2010 leadership class, and he and his firm have served as a corporate sponsor for a number of different programs, including Walk MS and Bike MS. Jamie's also served as an editor of the National MS Society's SSDI guidebook. So Jamie's level of expertise certainly speaks for itself. Well, welcome to the podcast, Jamie.
Thank you, John. I'm happy to be here and happy to help.
Well, I guess a good place for us to start is with a couple of definitions, because I know people get confused by this. Can you tell us the difference between SSI and SSDI?
Yes, and you're correct. A lot of folks do tend to get lost in the weeds to an extent on these. SSDI, or Social Security Disability Insurance, is what most of us think of when we think of disability benefits. If you look at your pay stubs, you will see on there that money is being taken out for Social Security. Part of that is being taken out to pay for insurability in this program. And essentially, SSDI is the disability program there for folks who have a regular work history in their past and folks who have made a legitimate amount of money in their past as well. As a fallback, in the event someone doesn't qualify for SSDI, in the event they were very young and weren't able to work or stayed home as a housewife or for whatever reason, if there is a lack of recent and lifetime work history, then you would fall back to the SSI, or Supplemental Security Income Program. The SSI pays a much smaller benefit, and the benefits from that overall are much weaker in quality. SSDI pays both a Medicare eligibility benefit, and it also gives you a higher income benefit, oftentimes between $1,000 and $2,500 a month. So there's a lot more ability to collect under SSDI, again, because a person has worked and paid into the system, so the system's more willing to give them a bit more going forward.
You know, if you spend any time online reading some of the experiences that some people have applying for Social Security disability benefits, if you read some of the what I'll call conspiracy theories, and I know you've heard them, a popular one is that everyone is denied the first time they apply for Social Security disability benefits. So you expect that, and then you figure out a strategy. There's just a lot of confusing noise out there. So help us understand, why do people get denied when they apply for Social Security disability benefits?
Yeah, and I've heard that a lot in the past as well. And in all honesty, a lot of good claims are denied at the initial level, but certainly not everybody. There are some things that the SSA generally looks for in a claim that dramatically increase the odds of being approved at the initial level. And before I go into those, it's important to remember that there are appeals out there. You can appeal an initial denial to reconsideration and to a judge. And those appeals are there for a reason, to correct errors made at the initial level. My view has always been that if a claim is worth filing, that claim should also be worth appealing. So first and foremost, if you are denied at the initial level, don't give up. Be happy to appeal and do it well, and you can get these issues corrected going forward. That being said, at the initial level, the SSA tends to target a few items for approval. One is they look at the age of the claimant, and it's really important because as the claimant gets older, the standard for disability gets easier. And you can imagine as a person gets older, they will have paid more into the system. They will have less time during which they're taking funds out of the system before they hit retirement age. Age 50 is the key divider in that process. A person under age 50 must show that they can't do any kind of work on a full-time basis, no matter how simple that job is, no matter how low-paying that job is. It's a fairly difficult standard. A person over age 50 must show they can't do their past work in the past 15 years or work that would have them on their feet. Still a difficult standard, but one that's much easier to pass. So again, at the initial level, an individual under 50 applying will have a much more difficult time. One of the other major items the SSA looks at would be the medical records, the state of those. If a person has been regularly treating, has been compliant with treatment, and their doctor, in the MS world's case, specifically a neurologist, is supportive, the odds of approval go up dramatically. If a person is not compliant with therapy, with medications, or if their doctor, such as a neurologist, is not doing a good job documenting what's going on in the file, the odds of approval drop notably. So again, before a person even applies for disability, it may behoove them to speak with their doctor to confirm whether the doctor supports the claim, and maybe even to look at some of the medical records just to see what's on there. One of the major issues we see with medical records is as things move to electronic medical records, we see a discrepancy or an argument between the narrative report, the doctor's paragraph, and some of the auto-generated information. Whereas the doctor may be writing, complains of fatigue, has significant gait issues, but the auto-generated text may say, walking normal, fatigue normal. So even little things like that can make a big difference at the initial level, where the SSA will never really see you in person, and they're just going off the paper on your file.
Besides making sure that you understand, especially if you're applying under 50, that it's not only about you not being able to do your job, but being able to do a job, any job, and recognizing things like making sure you speak with your doctor about their records and have that all as much in alignment as you can control as a patient. Are there other things that everyone can do to increase their chance of being approved for disability benefits?
Yeah, being responsive. Social Security will reach out at times for clarification on treatment. They will send out forms, typically a work history report talking about your past work. They'll issue a daily activities form talking about what you do in a typical day. Taking real time and real thought on those documents to give the SSA good information upon which to base their decision really does make a difference. The easier you can make the adjuster's life, oftentimes the easier it is for them to do their job, and that may help your claim going forward. It will also help a person on appeal because the judge and or counsel in the future may look at those same documents. So if they're done well, it makes everyone's job a little bit easier. But responsiveness to the SSA itself is always a big perk to have there. A person also should keep in mind that the SSA will look at their past employment history. A person who has a good, solid, strong course of employment leading up to disability will generally have an easier time getting approved, especially if that work has shown reductions over time. Say a person who was working as a manager reduced their position down to a non-manager level position, then went down to a part-time position before filing for disability. Those trends show increasing limitations and show a real desire and effort to remain at work as long as humanly possible. So again, little things like that can show a basis for a claim, and that may be something the adjuster relies upon in making a decision in a disability case.
How long does it take for someone's application for Social Security disability benefits to work its way through this system?
Yeah, so you're generally looking at 3 tiers to the decision-making process. Tier 1 is that initial level where they say everyone gets denied, and Tier 1 typically takes about 3 to 5 months. And a lot of folks who contact my office wonder, why would it take that long? But you have to remember, the SSA has to gather all the information from the claimant and from the doctors, have to have that reviewed by their own doctors, then have to go ahead and process and issue a decision. That takes a bit of time. So the initial application is typically 3 to 5 months. If you appeal that, you go to a step called reconsideration, which is where there's very rarely an approval that occurs. And that typically takes about 3 months or so. If you're denied there, you request a hearing in front of a judge, and that greatly varies by what location you're located in. The numbers are getting better as far as how long it takes to get to a hearing, but most people should typically anticipate an additional 18 months or so. So you're looking at probably 5 months plus 3 months plus 18 months, which that's over 2 years. You could easily be waiting for a decision to get your disability claim approved by a judge if necessary.
Separate from Social Security disability, there's also something out there called long-term disability insurance. Can you explain what that is?
Yeah, long-term disability insurance is a private program that you may obtain through your employer. And not all jobs have them, but many jobs do. And this is where you actually have coverage through an insurance company, and it's separate and distinct from any kind of benefit through Social Security disability. The beauty of those benefits is they are much closer to your pre-disability income, and they can be easier to obtain in some scenarios there. So again, you want to look at your pay stub and see if there's extra money being taken out by your employer to pay for an insurance program. Or in the event that your employer offers this and they pay for it, there should be notations of that as well. But again, it's separate and distinct from Social Security, and that is private coverage there.
And if someone has long-term disability insurance coverage, is it as complicated to submit a claim as it would be on the Social Security side? Is it as challenging to have a claim approved if you have this long-term disability insurance?
It is and it isn't. It depends on the scenario. I find many individuals are able to file the initial application for long-term disability with much more ease than Social Security. Generally, we recommend that you get an attorney on day one in Social Security because of the complexity of the initial filing. For long-term disability, many individuals can file the initial documentation on their own. The catch there is that the claimant is responsible for getting all relevant documentation in front of the insurance company. So if the insurer can't get records from a certain doctor, it's ultimately the claimant's responsibility to get and provide those records. Additionally, there's typically a form in there to be completed by the treating neurologist, and the insurance company will request it, but it's the claimant's responsibility to make sure it gets in the claim file. So if everything goes smoothly, long-term disability is a much easier process. But if there is a denial, or if there is a doctor who is less than compliant in providing medical records, it gets much more difficult very quickly there. The other catch you have is upon denial, things get very complex very quickly in long-term disability claims. And really, to file an appeal, there should be a full and thorough review of the entire claim file. And this includes what could be hundreds, if not thousands, of pages of medical records, significant reviews by the insurance company, review of vocational information. And on the appeal, it's important to have counsel. You are only allowed one or two appeals by the insurance company before you go to federal court. And one of the big catches and the big unknowns in that is that once your in-house appeals with the insurance company is exhausted, in federal court, nothing new gets in front of the judge. So if you have filed a letter that says, Mr. Insurance Company, I sincerely disagree, please reconsider, and they then deny it again, nothing new would get in by your attorney down the road. So again, that's why it gets really complex on appeal in those cases. You've got to be really careful.
You know, I actually know someone who felt very fortunate that they had this long-term disability insurance coverage from their employer. As their MS progressed, they submitted a claim, and the insurance company, after a period of time, sent them a letter requesting more information, and they forwarded that information, and after a period of time received another letter asking for more different information, and they forwarded that. And then when they didn't hear anything, the insurance company claimed that, gee, they never received all that additional information that actually was sent to them. It sounded like a way for this particular insurance carrier to just delay the entire process. What can people do if they feel like they're being put on hold or given the runaround?
So what my office does, having learned about this over the years, is when we submit an important document, we counter it for a follow-up call a day or two later. And we always submit documents either via facsimile, where there's a confirmation that we get back that specifies the number of pages submitted, or if we mail it, it's always with a return receipt. So we have, again, a signature of someone who received the document. Again, we also call in a couple of days later and ask the adjuster, did you get Dr. Smith's records? Did you get Dr. Jones's statement to confirm the receipt? The inability to properly process documents received is a chronic issue in these cases. It is not something that's unique to your friend whatsoever. Whether it's an individual claimant, whether it's an insurance company, whether it's a medical provider, whether it's counsel, all of us are struggling with this issue. And again, you can correct a lot of that with a simple phone call. Or if you have email with your provider, you want to go ahead and email the adjuster just to confirm they got it. That way you have it in writing. It's also really important with these long-term disability claims to keep a contact log of who you speak to, when you speak to them, each time. Because that way, if anything does arise in the future, you can say, no, my adjuster told me on this date, at this time, they received these documents, and here's my proof of that. I documented the call. That can be a really powerful piece of information in the event it's needed.
Well, Jamie Hall, thank you for doing so much to shine a bright light on a process. It's so important, yet seems just incredibly challenging to navigate. People who are living with MS are very fortunate to have someone like you on their side. In introducing you, I mentioned that you edited the SSDI guidebook for the National MS Society. I want to mention that the book is available as a downloadable PDF file on the Society's website, and I'll be sure to include a link to that book in today's show notes, of course, along with a link to your website as well. And I want to thank you for taking the time to talk with me today.
Great. Thank you much, John. I wish your listeners the very best in the future. And it's a long road. You've got to plan. You've got to be patient. But if everything's done right, it can be successful, and I wish them all the success in those claims. Thank you, John.
That's going to wrap up this episode of Real Talk MS. And before I let you go, I want to invite you to download the Real Talk MS app. You can download the iOS version of the app from the Apple App Store, and you can download the Android version from the Google Play Store. The app is free, and once you've downloaded the Real Talk MS app, you can go into the settings and decide how many episodes of the podcast you want to save to your phone. And every week, the latest episode of the podcast will automatically download and be waiting for you. It's just that easy. You'll be able to save the episodes that are especially important to you. And I decided to kind of create this app to make it super easy for folks who may not regularly subscribe to podcasts to be able to access Real Talk MS every week without even having to think about how to do it. And as a bonus, well, the app allows me to share additional content with you. So in the coming weeks and months, I'll be able to share video content, written content. Well, the app just gives us more ways to connect over meaningful content that I think you'll want to know about. So head over to the Apple App Store or the Google Play Store, download the Real Talk MS app, give it a test drive, and let me know what you think. I'm John Strum. Thanks for listening, and we'll catch you next time.